Hello friends, folks, family and insignificant others. I'm Goemon and I need to talk to you about COVID-19. Look, you're probably tired of the subject by now, but this is not one of those barely vetted opinion pieces. Instead, I will provide you with vital information so that we may have an actually informed discussion instead of a pointless rant down in the commentary section. The coronavirus is an RNA virus affecting the respiratory tract, that is your nose, throat and lungs. This family of viruses spans in severity of affection from anything between a mild cough, as in our seasonal cold, right down to muscle pain, vomiting and diarrhea, as in MERS, the Middle East Respiratory Syndrome. That also explains why most, if not all, coronaviruses come with flu-like symptoms, because they all cause flu-like diseases, as they are all affecting the respiratory tract. Corona, by the way, comes from a Greek korone, meaning garland, later adapted in Latin, meaning crown. This is a group of viruses that is characterized by spike proteins forming a crown-like form. Keep in mind that classifying viruses is rather difficult because they don't adhere to common species concepts. So basically we group them by what they look like and what they do. Now you may be forgiving for calling these flu viruses, but they are not. Also, flu is a disease, influenza is the virus, and it is not a coronavirus. Confused yet? Alright, think of a broken bone. There are many ways of contracting a broken bone, but the doctor will treat every one of these patients the same way, basically immobilizing the broken bone and telling you not to do that thing again that made you break your bone. But the cause for this can differ a lot. Maybe you fell off a motorbike. Maybe you got crushed by a printing press. Maybe you are a 7-year-old boy who in his childish exuberance discovered with some latency that tricycles do not make good step ladders. Okay, some of these causes are a lot more common than others, but all of them lead to the same outcome, a broken bone. Just the same, many different viruses affect the respiratory tract, many of them causing cough, fever and snot running out of your ears, which we commonly refer to as flu-like symptoms, because the flu is the one disease that we are all familiar with. The SARS-CoV2 virus causes the disease Covid19, a disease so called, by the way, because its causal agent is a coronavirus, COVID, and the first outbreak was recorded in 2019, to Covid-19. SARS stands for Severe Acute Respiratory Syndrome. You may remember that the first SARS virus made its first appearance in the year 2002. However, the first SARS virus caused a much more contained pandemic, with less than 10,000 people affected, and still 11% mortality rate. This is the point where you should listen up and realize that this SARS-CoV-2 virus and associated COVID-19 disease are not just another harmless variation of the flu. Are you listening yet? SARS-CoV-2 is not a flu virus, and while yes, it can cause mild coughs and fevers, outbreaks of COVID-19 can be so much more severe. And while it is easy enough to lecture a 7-year-old boy on the kinetic instability of tricycles, it is much more difficult to prevent most people from breaking their bones, because broken bone disease can have so many causal agents. So here are some key aspects of why this COVID-19 disease is so dangerous and should have you worried to the point of, oh my god, this is a global health crisis and I should do at least the very bare minimum to protect others from contracting this disease. Number 1. 1 in 5 cases are asymptomatic. That means you can propagate the virus, breed it, give it to all of your friends and family, and never know that you even had it in the first place. This is why it's not enough to isolate people who are currently coughing and sneezing. Depending on age and climatic variation, 5 to 50% of all the contacts in your life may be asymptomatic carriers. That means 5 to 50% go about their lives infecting other people with a potentially deadly virus and having no knowledge of it. Number 2, transmission. Apparently it takes about 1,000 virions to affect a new host with the COVID-19 disease. There are about 3,000 droplets of body fluid in one cough, 40,000 in one sneeze. Loud speaking, not to mention singing, expels a couple of thousand droplets per second. Any one droplet may contain none to several virions. And these virions travel and survive in droplets the size of aerosol particles, meaning you can speak them out and they may linger in the still air for minutes before somebody else snatches them up on their arm sleeve, thereby transmitting thousands and thousands of virions that you merely breathed out. And if they breathe enough of them in, these will propagate in the throat and nose and cause a new viral host to emerge. I will return to this topic at a later time when I talk about face coverings, but what you should take away from this now is that just a few seconds of talking can populate still air with enough virions to start a new infection. Of course, this effect dissipates with distance from the host, and it greatly helps to be outside, where even a soft breeze can carry away quickly all the virions that may otherwise harm you. Number 3. Severity of infection. 5% of all COVID-19 cases require hospitalization to some degree. That means a bed in a hospital with staff like nurses and doctors to care for you. 1 out of 5 hospital cases require hospitalization in an intensive care unit, an ICU. That means a bed in isolation with specially trained staff, nurses and doctors that tend to only very few patients and need specialized medical equipment. In effect, these require a lot of time, equipment and medical personnel. All of these resources are limited. If you have more patients in your province that require intensive care than you can care for, you will have to ship them out to other provinces or countries. If another province or country does not take these patients, and you lack the ingenuity of creating specialized medical equipment out of the back of your garage, these patients will die. Most industrialized countries have a hospital bed capacity of about approximately 0.5% to 1% of the population. And roughly 1% of these hospital beds are intensive care beds. That is not to say that 1% of 1% of the population could actually get intensive care in your country. That only means those beds are available. That doesn't mean the personnel is there to attend to it. So here's what a severe case of COVID-19 looks like. COVID-19 affects the respiratory tract. It may start an inflammation that starts in your throat and nose and migrates down to your lungs. An intense inflammation of the alveoles in your lungs is called pneumonia. Pneumonia fills the lung with goo, making it difficult to breathe. In essence, the alveoli, those tiny gas chambers in your lungs that are responsible for gas exchange, can no longer do their job because they are so inflamed. The more severe that inflammation is, the more difficult it is to breathe. In approximately 1 out of 4 ICU cases, pneumonia is so advanced that they require a ventilator. Not all of these patients survive because severe pneumonia is rather difficult to treat. Look, this is not to scare you, okay? But keep in mind that this virus spreads like an iPhone update, and 1% of all the people affected by it need intensive care. Most industrialized countries have reached their ICU capacity. Some already have exceeded it. Belgium, for example, has started shipping out their ICU patients at the beginning of November. Luckily, Belgium is a country of the European Union and has strong allies. Do you? That means we cannot afford more severe cases of COVID-19. Since 1% of all COVID-19 cases are severe, we cannot afford more cases. Are you with me yet? Number 4. So, we have a disease that is spread by people sitting down next to each other and talking for 5 minutes. 1 out of 5 infected spread the disease without even knowing that they have it. And 1% of all infected require intensive care that we have very limited resources for. For many people, that is enough to take the SARS-CoV-2 virus serious. Thank you for being a decent human being who cares about others. But maybe you are special. Maybe you follow the sentiment of a German alternative right party whose leader literally said, "We have to be considerate in our response, even at the price that people die." Maybe you need a personal and selfish reason to not spread COVID-19. Here's one. Even if your initial reaction to the SARS-CoV-2 virus is rather mild, you may still suffer long-term consequences. Many people who contracted COVID-19 complain about fatigue, shortness of breath, chest pain, joint pain, anosmia, hyperosmia, memory and sleeping disorders, and other difficulties, even months after full recovery. Why? We just don't know. What we do know is this. The SARS-CoV2 virus is dangerous. The COVID-19 disease is extremely contagious. More so than most other diseases that we've seen on this planet. 20% of the affected do not carry any symptoms, spreading the disease unknowingly. 5% of patients get hospitalized. 1% require intensive care. And many suffer from long-term complications that we don't even understand the reasons for. So please, at the very least, take this pandemic serious. Take the necessary precautions to prevent the spread of COVID-19. And whenever you meet anyone, wear a mask. More on that delightful subject in my next video. Thank you so much for listening. Please leave your well-considered comments and questions down in the doobly-doo. Share and like and subscribe and whatever else it is that the cool kids are doing these days. And have a great pandemic and stay healthy.